Manasa Rek. We are going to discuss tuberculosis and also radiology in diagnosis. These are the things that we are going to discuss. You have been hearing a lot about tuberculosis, and you have also heard about radiology in medicines. Radiology is one of the things that we know when you go to hospitals, so that you'll be checked. That's X-ray, and if you have anything in your body, maybe you are sick or you have some injury inside, then there is also a scan that should be done using radiology. So Dr. Nyabol Manassa, she is a professional doctor in Morocco, and she's also well informed in the field of medicines. And I think she will tell us more about the radiology and also tuberculosis. Dr. Nyabol, thank you so much for joining our call podcast today, and we really thank you for the opportunity that you have taken. You'll just bear with us despite the coolness that you are going through there in Morocco. You guys are near with the river. Situation is good and it is really very cool. And Joe is Ruba, as people say in South Sudan. And we are here suffering from the sun. The sun is really hot. You can even see me, I'm also sweating right now because of the sun. But you guys are really enjoying nice weather, and these things also is nice. Of course, yes, to take your time and also study abroad. So one of the things that we also need to thank you for. And Dr. Nyabol, I want to ask you questions. What is radiology indeed, and what are the logic behind radiology? You know, why do hospitals use it, and why do we use it to scan some of the diseases, and also why do we use radiology, and what is radiology? Thank you.
Okay, I could say radiology is, in simple terms, is just image diagnostic that help doctors to see inside you without having to cut or do surgery. So without radiology, we could have done 1,000 surgery that might have end up in a fault results. But when we do radiology, we get to see your internal organ or we get to see the inside you, and hence we can locate the tumor or the problem. Maybe if a child have swallowed a coin, we take a photo of that child and we know exactly where have that coin reach up to. So it is with the help of radiologists that we get to see inside the patient without taking precaution like maybe having to proceed with surgery. And also we are there after surgery. Like after surgery, we get to also see how far is your recovery taking place or what next should be done by a doctor. We are there to tell the doctor this is what is happening inside this patient and this is what have to be done. That's in simple terms how I could define radiology.
Yeah, okay, but sometimes people feel panic. Sometimes I also have one of the relative who was staying with the stones. People say it was a stone, of course, yes, in his stomach. Okay, and he has been living all this long. There is nothing happened. So, and his situation is okay. If you meet with him, he's really okay. You can see he's healthy. He's even very fat, But after a while, when he go to hospital, he went for his scanning, okay, and then somebody told him, radiologist. He told him that after I scans the whole body, I have found that you have a stones in your stomach. Nyabol, my uncle didn't sleep during that time, and he was really okay, okay. But unfortunately, within that statement, and then he has really changed, has completely changed his face, and when you see him, you can see that he's really suffering from something. This bring me to a situation that why do some patients panic when they heard that there is something inside them?
Honestly, I could say like sometimes we live without knowing that our body is going through a lot. And then also radiology is not too healthy. To be honest, it's not healthy even if to us the radiologists we know that it is not something for joke or something that just have to be done. It's when the doctor take a final conclusion that indeed you need to do this radiologist to know exactly what is happening to you. But without that, the mere thorax x-rays, we are going to give you radiation that a sunshine can give you in 3 years time. So it's dangerous for the health, the radiation itself. Even for us the radiologists, we need to wear certain things like a lead made cloth that could protect us from the radiation. And hence if someone just get to do that one, it's even harmful for that person's health. I think that patient was panicking because he get to know exactly he's now having this problem and what else can he do. But it's for the better, because the earlier you know what is happening to you, the the better the treatment. But if you know when it has already reaches the final state, there's nothing that can be done. It's mostly complicated. So sometimes we, yeah, honestly, also when you entered in that machine without removing your metallic things, it's really really dangerous to the point that they can maybe call emergency or something, because there is a magnet, especially the ERM. It has a magnet that attract the anything having adit, even if your phone, it will just pull it in a very high force, which is also scary for the patient. That's why we need to explain it to you that this thing is like this, and we need to do it precaution, like remove all your clothes or remove all the metallic, maybe the gash and the rest of the thing, your phone and anything concerning metal, even if earrings, when you're entering ERM room, we need to remove all those things. So it's really a complicated cause that scare people, but you don't need to be scared when the doctor decide that it see the advantage more than the disadvantage. So I recommend patients not to fear when they recommend them for that, because they need to know before taking operation that what is happening in their body. They shouldn't fear about us.
Okay. That is true. But I thought that people used to be taken inside the machine without even checking, without even so. But I really wonder. There was a post that I came across. I don't know. It was last 2 months. No, it was last 3 months. I came across a post, and that post, it was an X-ray. Okay, somebody was scanned, and then there was a cockroach that I have seen in the image. Okay, so he went to the hospitals, and they told him that your body I mean, in your chest you have a cockroach. Okay, and through the what through the image, I don't know how do you call that, images. Then it was recommended to go outside the country for further checkup. So after he went to another country, then he was told that it was a machine. It was a machine that scans you, is the one having the what is the one having the cockroach, but it is not you. Imagine this scenario. I don't know, how do cockroach stay there also in the machines, and why does machine not indicating that there is something inside the machine so that it should be removed out, or is it a unprofessionals? The person who was doing it is unprofessionals. I try to understand that, but sometimes I used to confuse, and I say maybe this is a unprofessional things that was done by the radiologists. So what do you say about that? Have you ever come across that post?
Yeah, it was in Juba News something. I got that post. But honestly, in the situation of our country, we get to do whatsoever we do. But if it was other country, that person was supposed to be maybe in, because we have rules, by the way. If you get to give someone X-rays, exit or less, you are supposed to be punished, because why? Like for instance, if you are supposed to give thorax and you give more than that, you are supposed to be asked. Honestly, those machines also, they take so long. Like for instance, the ERM, it lasts for more than years. Once it is installed, they don't always remove it unless if someone get to be pulled by those by that, or maybe even a chair wheel which carry the patient inside. Then if it happened that the chair wheel knock the patient or the patient is entering dead, that's when they shut it up. And reconstructing again, it takes over 1.5 million. I had like that. So those machines always are always there, but they need to be cleaned up like as frequently as possible. Like maybe after every 2 days, you need to clean those machines. I think it was just because of South Sudan or because of professional. I don't think. And even they do teach us also how to read the radiology. Like how to know this is a tuberculosis, how to know this is a, this kind of disease, how to know this is this kind of disease. We get to read those things before finally graduating. So I think that person just did not know, because how does a cockroach like structure appeared in your chest? It's not logic. So I really could just say because of our country's situation.
Okay, Nyabol, thank you so much. Yeah,
Apologies.
yeah. Now, I also have observations, and I also want to ask, uh, what is the difference between that machines that when pregnant mother is pregnant, then I can see there is that machines used to be put just in abdomen to check how is the baby and so. Okay, and there is also the machine that you people used to put you inside, complete human being inside the machine. I don't understand the difference between these two machines, and maybe there are a couple of the machines. We need you also to tell us what type of radiologists that you know, and what type of the advanced equipments and materials that different hospitals, let's say those advanced medical hospitals, are using today, and what is the difference? Do we have a quality machines, or do we have also effect machines in radiology?
Yeah, we have a lot of machine in radiology, like panogrammy. That's only for the teeth, only specialized for teeth. That one for the stomach, it is called echography. That one is only for pregnant women. And to your surprise, when someone is pregnant, we don't do X-rays, because just a zero point 0.1 milli, millicentigrade, it can abort that child. So that echography, it doesn't have anything to do with X-ray. It is so good for the child and the mother, and that's the only thing we use. When you get maybe an accident or something as a pregnant woman, your partner has to sign that, yeah, you guys proceed with this thing, so that we can deliver to you anything concerning X-ray. So those machines are really, really so different. And ERM only has a magnet. It you can be entered inside, but it's only magnet that is going to help us visualize those images. And then there is another machine also, we enter you inside also, but it's called X-ray. It is called CT scan. CT scan, it having X-ray. That one is dangerous for anybody pregnant or a child. And then the standard X-ray, that one they can use maybe if your hand get a fracture or what or what. That one also we don't use it for anybody that is pregnant. And then the echography is the only machine. That's why they use it for pregnant women to check their child and the rest of the stuff, because it's faster, and also it is so secured for them. Yeah, it helps us to visualize how the child is, how the child is doing, if there's any problem, and there's no harm on the child and the mother. But if it happened that the mother has a fracture or an accident, the partner or someone so close to them, they will also see how big is that fracture that need to be done with X-rays, and how healthy and how complicated will it be to this mother. So it's a decision that is always taken by the parent or anybody close to that person, to take that, yeah, we are responsible for anything that happened, because honestly that child will have that person will have miscarriage once we deliver that X-rays to that person. So those machines, honestly, you need to know them, all of them. Okay, during this course they really teach us about all of them, what to be done with this kind of person and what to be done with this kind of person, and what situation should you proceed. Like it may be the accident is so complicated and the mother is about to die, and then the husband will decide whether to the life of his wife or the life of that child. And that one will not be on us. We shall just do what is there, but we shall inform you that if we do this, this thing will happen. So it's your family members to decide what to happen. Yeah.
Okay, this is really great explanations, Nyabol. Thank you so much for telling us more about this. You know, I'm really learning some of the good information from you. And we are proud that we have these kids that also have knowledge in medics, and they will also provide health facility in South Sudan. And we all wish you the best, so that you do a lot in radiology, and the information you have currently, they really speak a lot. And some of the issues that we are going through in our country today, including radiology, is one of it. Now, Dr. Nyabo, let us come to tuberculosis. In South Sudan today, when you go to, let's say in Juba, you go to Awil, you go to Bantu, you go to Torit, or any other places in South Sudan, you may find that young people are suffering from tuberculosis, and you may see them, uh, young people's, those who drinks alcohols. Okay, those who drinks alcohols, sometimes they are likely to be attacked by tuberculosis. And I don't know, tuberculosis, when I learned this in my secondary schools, it was like a bacteria, okay, that it is infectious disease, of course. And the way it affects people is through sneezing, sinking, and also coming in contact with the fluids from the persons who is infected with tuberculosis. And sometimes you may find that a person who is suffering from tuberculosis, you may find that it is from the lung, and sometimes you may find from the bones and so. And I don't know what is the difference between this tuberculosis, that tuberculosis in the lung and the other one in the bones. I used to hear like that, and our youth today are suffering from this disease, and I don't know what are the symptoms of that disease, and how do we cure that disease uh, in order for our people not to be infected by that disease. But I don't know why is it related to alcohol. So when you drink alcohol, this is the moment that you'll suffer from it. And I'm out of Malo. Is it that when you drink alcohol, then you get tuberculosis, or what?
Not really. As you have already said, tuberculosis, it's a hair-like bone disease that is always in health. Like for instance, right now, if I have tuberculosis, I get to maybe sneeze or cough in public. The virus bacteria will come outside from me, of course, and they will be suspended in the hair for some time. And then if someone else, like for instance you come to the same place, you can inhale it. And actually it affects 99% of the world, 95%, and over a billion of people, but we are not aware. I'm not aware that I have this tuberculosis. You are not aware because it has two types. When it is having lattice and active, when you are in lattice state, we are the 95 people. We don't know that we have it. But when you are now active, like that 5% of those people, you can now have signs like sneezing, coughing, like for more than 2 to 3 weeks. You can maybe cough blood sometime. You can feel fatigue or tiredness, and then weakness in your body for no reason, and you are getting to lose some weight and without any reason behind it. And then if now those happen to you, if you still this one resist and not go to the hospital to check up yourself despite that fatigue and the rest, and then it will proceed now into another type. Yeah, it always starts from the lung, because when we inhale the hair always goes to the lung to be filtered by the alveoli. But when it now reaches the lungs, okay, I could say with alcohol people, those people, they already have weak immune system. They have already weakened their immune system with those drugs, because alcohol, it has chemical inside it. Those people who smoke, they have already weakened their immune system, and the immune system will not fight it. Like for instance, right now I'm healthy, I inhaled it. I have that immune system like a police that is inside me that always fight anything that is not healthy. But once I get to drink, eat these things like shad and the rest of the things, I'm getting to kill that immune system inside me. And hence anything that come as a strange thing, I don't that police will not have the capacity or the power to fight it back. Hence why we always have it in South Sudan is because we have overpopulated area. Like only 5%, I could say, in South Sudan are in good place. The 99% of us, we are in a poor ventilated area, no air condition, no what. So we are always together. Let me say, like, we are always together. And one person can give it to all of us. For instance, situation in camp, not even camp, even let me say custom. Yani everything is just we are together. People are also in the bush, those one fighting, they are always together. So one person can give it to all of us. And yeah. And then when now it reaches your body, you have ignored all those signs, the coughing and the rest. And then now that your lung will not tell, because our organ, they work together. They are like a system. And your lung now will give it to his other brothers. That is your brain, your brain, your kidney, and the rest of the stuff. It will now travel around to affect other bodies. And then as it proceeds, without you coming to the hospital, without you taking precaution, like taking precaution about that, it will increase until it really reaches its final state. And I could say also, there is no vaccination of BCG. Like our kids are not really vaccinated. People produce kids in the rural area. I could say even within Juba, but they don't take kids for vaccination. They undermine this vaccination. The day that person get out of the hospital with the child, he think now the child is so safe. He can again maybe be going back for minor thing. They don't know that this small vaccination, they tell us that come after 2 months, come after 9 months with the child to be vaccinated in these government places. They are so important for this child. They don't, most of our parents, they are illiterate and they don't know about that. Hence, there will not be also help in our immune that could fight it. I could say that's all about what I know about tuberculosis.
Yeah, yeah, yeah. Thank you, Nyabol. That is really great discussions, and this is a good conversation, by the way, because we are well informed of what you are saying, and this is a good thing. You know, I didn't know more about this disease, but you have now really said a lot of things that are around tuberculosis and why most of our people suffer from it. And you know, 5%, as you said, of the people are free from tuberculosis, and this might be the people that are living in good ventilation, and they are also living in a good environment. That's why they are not suffering from that disease. But like I say, we might be having uh, in a crowd place, maybe for example in custom, as you said, you know, and this is what I don't like from being a doctor, by the way, because being a doctor, sometimes when you are in crowd place, you will get disease. When you drink too much water, you will get disease. When you eat shorba, it will get disease.
No.
When you eat anything that you eat, they used to find something in that you may suffer from this, you may suffer from this. You know, I really confused. And you know, staying together sometime is good. Of course, yes. Maybe you want to go to market, and you want to stay with people, and these are also a social thing, and you have to stay with people. But sometimes science always don't recommend people to stay together, but we as a human sometimes we don't accept, but we have to do whatever that is good for us, and then we stay together, and that is the best thing, of course. Yes, now to our viewers, I think you will take a lot of precautions, as Dr. Nyabul say that you need also to protect yourself. So prevention is better than cure. You need to stay in ventilated area where you get a fresh air instead of, and avoiding contacts with the person suffering from tuberculosis. And also you need to wear face masks if you are about to stay in contact with a person who is suffering from tuberculosis. That is it. Now this will bring us into the question of radiology and tuberculosis. So how many times do we recommend people to go for follow up in radiology, and in order to detect tuberculosis? For example, if I'm suffering from tuberculosis today and I want to know whether I'm still having tuberculosis, and maybe I'm taking medicines, okay, I'm taking some drugs. Doctor has given me drugs so that I take them, and I want to follow up so that to see whether I have tuberculosis again or I don't have any tuberculosis. So how many time will I take in order for me to go to the scan or to the X-ray, so that the tuberculosis should be seen whether it is there or it is not there. Sometime I was having my brother, he was suffering from tuberculosis. He used to drink, of course, he used to drink alcohol, but unfortunate, we have taken him to hospitals, and then it was found that he has a tuberculosis. Okay, and at some point, he was given drugs and those drugs he has taken them, and after a while, he refused to go back to hospital. And then the doctor didn't recommend us that you need to come in this day, you need to come in this day, so that we should check. And I don't know, I really confused. Is it really that if you take medicine, then this disease will go away without even checking it again, or there are some time that you have to go to X-ray so that it should be checked whether you have still have tuberculosis or you don't have tuberculosis. I also want to know, is there a severe tuberculosis and minor tuberculosis? In case if they are there, you need also to tell us. But is there just only as tuberculosis?
No, it has two states, as I've said. 90% of us are having lattice. That one we get not to know it, and we cannot spread it to other people. We just have it, maybe we just inhaled it for one time or twice, but our body can fight it. That one we have no problem. I cannot spread it to other people and the rest. But when you are inactive now, like that brother you have said, that's when now they become thin. I don't know if you have ever stayed with these people. They now lose weight to the point that only bones are moving. They now don't even want to eat. Their body is always weak no matter what we do to them or which kind of food we give to them. That's when now it is active, and that state now it is serious. But that state now, when it has now reached to that part where someone is just moving as a walking dead, or let me say bony, it has mean that it has reaches other part like the brain, the kidney, and the rest of the part, and that one now it will be complicated to be treated. But as early as possible, maybe you just started coughing, as I said, just started coughing maybe constantly for 2 to 3 weeks. You're just feeling nausea or weakness sometimes, chest pains for no reason, and you go to hospital. They will do some tests to confirm that it is tuberculosis, because sometimes there are other diseases apart from tuberculosis which are also affecting the body. So how do we know that it is really tuberculosis? They will do you IGRA. That one is a blood test. They'll take your blood and confirm it in the lab. And then also maybe they'll tell that now you go for chest x-rays. When you come not for us to do your chest x-ray, there will be some halo-like structure, like some spot in your thorax. And then that one will give you the photo, and you go back to your doctor. Your doctor will say, yeah, for indeed you have tuberculosis and it has maybe reach the state and what you have to be done. They always give people antibiotics for 6 good months that you have to take every single day without missing. What causes those people to miss it? Because someone see like 6 months is so long. And also, since they are people of smoking and drugs, they get to forget what is important for them. Some even surrender that let me just die this disease and the rest. And some they'll just say they take it for the first maybe 2 weeks, and then someone relax. But it and when now you relax, you now tell the body that you now tell the disease that you can now resist. Because if you take the drug incomplete, it is better if you have not started. So if you have now taken maybe 2 months or three and you have stopped, now the body will manage to fight the drugs. Even if now you continue after stopping, it will never work for you. And hence that's what really complicated. But if you take it for that, I have a year, let me say 6 months, every morning and evening, that disease can automatically go away. Plus stopping, of course, those kind of smoke, drugs, and the rest, and eating very, very good food like fruit, nice food, not this one, weka or kisra or lia, this one. Those one, they don't really help us, let me say, reality. But because of situation in our country, those people, even we don't get to take care of them. Like, we know you are just an alcoholic person, so everyone undermine you, including your own family members. They will not like maybe go to the market to buy that meat or go and buy for you eggs just for you to get recovered from that disease. We get to abandon them. We get to not even care about them, and that's what really make the problem more heavier. We get to give them whatsoever food is available, yet they need special care. Let me say, they need that protein, that vitamin, and the rest, so that their body can come into normal before, in order to help the drugs fight the disease, because it is the drug and the person working together. But if only the drugs alone, it can't really work out. And then when we confirm it to you, we give you the chest x-rays. If you get to take those drugs, when you come back again, chest x-rays is never always repeated. It's always done only once. because it is dangerous for the health. Let me say after those 6 months you have taken your medicine or whatsoever, they come and give you your blood test again, and they find out maybe you are recovering. They add like that until when it is finished, and maybe they will check. They will send you for the second time to see your chest, and if they see, yeah, your lungs are now normal lungs and your body now is better, yeah, you are good to go. But honestly, that 6 months, most of the people, they don't really complete it, and that's what causes this disease to be the main cause of death, because they see 6 months is really long duration for me to take drug morning and evening, morning. Yeah.
Okay. Okay, Nyambol, this is really nice presentation, and I really like that. Taking us into tuberculosis, also taking us to X-ray, and also recommending us some of the things that we should do during medication, and of course, yes, we have some of the people when the drugs are being prescribed to them, sometimes they don't take them on time, and this is where you say it that sometimes most of the patients when they take drugs, some of the patients they just go to 1 month, some of them go to up to 2 months, or also 3 week and 2 week, and after a while they say that I will not take it. Then now the disease will just continue from there, and then maybe if disease is really serious with you, then you automatically die, of course, yes, because this that is it. Dr. Nyabol, indeed, you have really said a lot of things, and I appreciate that we have these young people who are ready also to help the society, because our society is really at the back, and our society is suffering, and that suffering is because that we have been in war since, and our people did not get good educations. This is one of the problem, and because of that, you can see sometimes we don't understand some of the issues, and we don't also value our health, and sometimes yani, we are really weak in health. We are also weak in educations, and these things because of that. So, and we also need the upcoming generation to be prepared, indeed, yes, so that we educate our society on the issues that are really important. For example, like what we are doing today is one of the things that will educate our society, so that our society will excel in some of the diseases that we have, because we cannot be in a country or in a nations and our people are suffering from some of the disease, and some of the disease they are really basics, some of the disease they are not that serious, like that tuberculosis is not serious when you take care of it, but when you don't take care of it, it may kill. You will die because of tuberculosis, and it is really a bad thing, of course, yes. Now, Dr. Nyabol, this will bring us into a point that our country is really poor in economic, and we also have violence across the country. You can see that we also have some of the patients. We have peoples in rural areas, let's say in villages. You go to Turid, you go to Chukudum, you go to Awil, you go to wherever you go, Malakal, you go to Nasir, you go anywhere else, where people have no access to health. And sometime, Dr. Nyabol, you may find that some of the some of the patients they have this disease with them, okay, but for you to check that this patient is having this disease sometimes is really hard, but you may see from the pace, you may also check how fatigued they are. Maybe somebody is feeling always tired, and somebody sometimes used to have a continued cough and sneezings and so forth. So all the time you can see that patient is suffering from the notable symptoms of tuberculosis, and you don't have the machine so that you check, because as you said earlier, that the first thing you do is for you to go to the doctor, and then after you go to the doctor, then they will sample your blood, and then they take it to laboratory for check up, and then you will be sent to X-ray for further checking of tuberculosis. And I talk about our rural areas, let's say in villages, where we don't have access to those machines. And these people, they need help. They need also to be educated on tuberculosis. In areas like those places, you may find that some people used to drink a lot of alcohols. Okay, they used to take a lot of alcohols. Even you can also attest that. This is really bad. But I don't know. How do you really check these people because they need support? If there is no machine, how do you tell somebody that you are suffering from tuberculosis, despite that you have seen the notable symptoms like what you said earlier? So ita ba mu shinu fi kalam de.
Okay, honestly, I could say like the only recommendation for the people in the villages. Honestly, these things, these communicable diseases, they are our government's work because I myself maybe I can install an X-ray center, yeah, but I will charge people to come and do that. But those kind of diseases actually they are supposed to be done for free for those kind of people because people who always end up ending their life in alcohol or what, those are people who are depressed. Those are people who maybe are going through a lot. And I could say honestly, nobody will ever go and collect all of them to give them medication or to tell them what to be done apart from our government. So honestly, like, I don't know what can we do as a doctor to confirm it to you, and we cannot give you medication without confirming that this is really tuberculosis. So take this drug for 6 months. We need to first confirm because a drug given for no reason or for another reason can kill the patient. So we need to confirm, and with just seeing you like this, we can't tell that this is the disease you are going through unless we confirm it. The only recommendation I could do is that we advertise those people that taking alcohol, because healthy person, let me say, for instance, me right now, even if I inhaled it like anybody, my body will fight it. Like our immune system normally, it has that ability to fight anything that is not inside it, that is strange or something, a foreign body that enter it. But when you already killed your immune system by taking those drugs, that's when now any disease can come and get you. So only thing we can tell them is that let them avoid those drugs, let them do other things. Like killing themselves by those drugs will bring nothing but more problem. That's the only thing we could do for them. And maybe avoid giving them money, because if you know that kind of person uses the money for wrong things, then the giver shouldn't give the person that money. Or maybe we get to give them good food. Yeah. And yeah, we get to keep their mind away from those kind of stuff like the drugs dealing and alcohol, smoking. And yeah, that's the only way we could do. But without those machine, like even that machine, by the way, radiology, for me to install it, let me say as a doctor, I could need millions of dollars for me to install that X-ray center. But as a government, it is possible for you. And like for instance, right now in Morocco here, 90% of these local people, they come to the government hospital, and the government hospital is so equipped. But for one person, maybe if unless you do corruption so that you can get that amount of money to open a lot of radiology center. So it is government work to really open those kind of medical stuff for each citizen to be helped. But normal person like this, you will really, really need a lot of money. And that's why if I do it, automatically my radiology center will be expensive because I need to recover back the money I used. And hence those poor people, they will not afford to come to my place to confirm what the problem they are going through. So the only recommendation is prevention is better than cure. Let them stop alcohol, let them stop smoking, and let's give them nutrient and the good food. Malnutrition is really bad. That's the only thing we could do for them.
Thank you so much, Nyamwal. This is a great thing, of course. Yeah. Indeed, yeah. I don't know in Juba if we have radiology center in Juba hospitals. I don't know. Maybe you will attest to it later on. And I have some observation right here. Maybe I want to know sometime, Dr. Nyambol, I may be suffering from a certain disease. Let's say I have tuberculosis today. Then I go to X-ray, and then X-ray may find it that I have tuberculosis. course, yes, I've taken my medicines, and the disease is now gone. Then tomorrow I will also go, then for another checkup, and maybe I will get another disease. And let me say, of course, yes. How do frequent radiology or frequent X-rays affect the patient? If you come always for checkup in X-ray, maybe I do it 3 times a year, maybe 5 times a year. So how likely will I suffer from radiology? And you talk about something earlier that it use massive magnetics and also a rays, a strong rays, and if they are emitted, then they may affect the patients or a human being. I don't know how many times do I go for X-ray or let's say for checkup. Yeah, if can I go 5 times a year or 2 times a year, or I'll just go only 1 time a year?
Okay. Honestly, X-rays are recommended by by doctor. Like if now doctor see that there is no any other option, that's when you are sent to us. But if there are other alternative, even us ourselves, we recommend you to take them because this center of ours is really dangerous. But when there is no other way out, that's when now you come to our place. So it's your doctor that is going to write it for you that you go for X-rays without recommendation from the doctor, or without that file being that comes with you that yeah, do the X-rays of this, and the patient is suspected of this and this and this. We don't get to do it for anybody. Even if my mom, if she want it, I can't do it for her because it's really really dangerous. Myself, we radiologists, there are clothes that we put on. Like if I'm at the hospital right now, there is a late made cloth. That cloth absorb the rays, hence it will not reach into me. Secondly, we have our room outside where you are that also protect us. And thirdly, the wall of the room of radiologists, it is always also made out of lead. Hence, it doesn't accept any rays to come out of it apart from the patient which is already inside. So all those protection measures, they are all done in order to make sure that someone is not exposed too much into the rays. So we need to, and we really really follow those things up, by the way. Like I can never click that button to deliver the rays to that patient when I'm inside that room. Never. I always position you. Then I get out of the room. I close you inside in that room. I go to my room where I be seeing you through a glass. That glass also it is made out of lead. Everything about us is made out of lead that prevent us. And hence I'll be knowing that yeah, you are in that exact position where I put you inside. Then I can click that button. So radiation actually, they are really, really something dangerous. A maximum human which is not a radiologist like us, it's supposed to have only 1.0.1 for a pregnant woman. And if it has passed that, they can be miscarriage, they can be abortion and anything with the future. And then for a normal person, maybe it can be up to two, but it doesn't proceed there. So for you to be sent to our place, it's only for confirmation. Like for instance, right now you are supposed to be doing surgery, operation of this place. So the doctor of, like for instance, our stomach is like this. It has a lot of organ inside there. Then they need to know exactly which organ are they going to cut. So they go and they come and tell us, you guys confirm it to us where this problem is. For us, we are just there for confirmation. But without confirmation, you never get to our center. Like without any special reason, you don't come to our center. So if the patient is has already been confirmed that he's having tuberculosis, other follow up, he will follow them up with blood test, not with radiology again. Once you're just confirmed, because the lungs show differently when you are having tuberculosis. But once not, they have already known, yeah, you have tuberculosis, there is no need of you again coming to our center. If you are getting better and better, like maybe say for instance those 6 months, they check your blood test, because it is just alternative. They have to check your blood test to see if there is anything that is going on with you. But once they check your blood test and they see that there is nothing going on with you, there is no need of you coming to our center because it's really dangerous. So I don't
Okay.
think patient come twice or thrice in a year for same thing.
Okay, that is wonderful. Uh, Dr. Nyabol, this is really a good conversation, and I think most of the people are learning a lot from you, and this is a great thing. And we are so proud to have you also in this show because we are also educating our society. And if we are educating our society, as I said earlier, so these are the steps that we should take in order to transform our society. Yeah, remember that our society will not transform if we don't speak, but we need to wake up, we need to speak so that we transform our society. Okay? Yeah, and then this will bring me also into the finals words like the one that I want to tell you now. Uh, for example, Dr. Nyabol, Masalan, we we may have primary health care center. Let's say in the village we have primary health care centers. In those primary health care centers, and mostly PHCC are viewed by government. Okay, government is the one responsible for those things, and I don't know how can we aware people about the importance of radiology, so that they should take radiology as one of the major thing in health facility. Without radiology, then a lot of diseases will really affect people. It is really radiology that help most of us, let's say people in the town. Sometimes radiology help them, but how can you tell people in the village that there is something called radiology? It is very important. It can check you up in case you have any disease. It will detect the disease, and then you will now follow up for medication. So how can you aware people about this radiology and X-ray thing, that they are very important, despite despite their educational background? Some of the people they don't know how to read. Some of the people they don't even know what is radiology. And now, how will you aware a lot of people so that they take up to go for X-ray checking and so forth?
Yeah, okay. Honestly, people fear us. They always say maybe that machine, if I enter, I might die or something. And maybe if someone get to see a photo online, that maybe some bad incident happened and the rest. And maybe that photo which was posted on social media as a radiologist is not doing that work well. So they get to really maybe criticize us for that. But when you're sent to us, there's something called a rendezvous Francais, I don't know in English. That way you come to us, you get that paper from doctor, and you come to the center of radiology that I'm told to come and do this radiology. We get you into the room and we explain it to you. Yeah, this thing is like this. We ask you 1,000 questions also. Are you allergic to anything? Have you ever done it before? Are you pregnant? And the rest are a lot of other questions. So you get to answer us, and then we ensure you that there is nothing hard or nothing bad is going to happen to you. This for your best. So we explain to you that, and then yeah, during that procedures also, when I close you to that room of yours, okay, once he's a child, there's always someone that is going to accompany, like maybe a mother or someone. But if you're someone big, we just tell you stay constant, don't move, and just be in that one position. So it is always scary actually, and also you being closed in a room and someone getting out and seeing you from the other side. You might think they're doing you something bad, but we explain to you that there's nothing bad. It's just a photo. Because also you when they're delivered to you, you don't feel the pain. Honestly, let me say. There is nothing, it's just like capturing a photo of someone. But the rays that will enable us to get the photo, it's us who knows that it is dangerous for you. That's why if a radiologist decide to do something bad, you can be in prison, or even yeah, in prison up to 5 years duration. Those are rules in our hospital. The patient know nothing about how dangerous it is, even if you have positioned them and the rest, and you have delivered that X-rays. They don't know how dangerous it is, but you are the one who knows that every organ need to get only this kind of rays. But like for instance, right now thorax is only 9. If I decide to deliver 15 or 20, I'm trying. What am I trying to do to that patient? I'm trying to do something bad to that patient. So it is always starting from us to know what to be done. The patient, honestly, they know nothing unless those on who are educated. And most people always come, no, I want radiologist. Let me say Moroccan here. Just they just like that thing from nowhere. No, I want radio like grandmothers. They just tell you that maybe go and do for the Nichols here. Maybe your legs they like paining. This thing of grandmother. Someone will tell you also my back is paining. You must photo it and my head and everywhere. Yet they don't know that the more you get, the more effect you have in your body. So we really like we always fight with the patient that no, you must only get this part of the thing. They will even be blessing you. No, my child, God bless you. Do this thing for me. So it all starts with the doctor. You need to know what you are doing. You need to protect the patient more than yourself. You need to tell them, yeah, I'm going to do only this and this, because you know if you are to proceed more, the law can sue you to 5 years imprisonment for just delivering a wrong measurement to a patient. So it's really on us, not the patient. Once you are sent to our center, we are the one to come and tell you what to be done, not you coming to tell us what to be done to you. The doctor will already tell us that photo this part of the body or this stomach is having this thing, and it is us now who will know what to be done during that procedure. So it always starts by the technician or the radiologist.
Okay, thank you so much, Dr. Nyabol. This will bring us to the end of the program, and I don't know if you have something that you want to pass also to our people. It has been a great conversation, of course, yes, and we really appreciate you for taking your time to come here in a call podcast to have a conversation with us. This is a great thing, and we appreciate you, and we also expect that next time we are going to have you again to discuss more about radiology and also about other diseases that we still have, and the diseases that could be checked also in X-ray and also and so. Uh, I want you to to greet some of our viewers who are watching us through. We also need you to say something to them and also to our general public. What do you want to tell them? Maybe they are listening to you and they have been learning a lot about radiology, and we have also touched some of the parts about radiology. So, in case of anything, this will be the final for us, and then we will meet next time. But I will give you this chance so that you also tell them about something. Welcome to our call podcast.
Come them for any question. And I could really just emphasize on let's take the kid for vaccination of BCG when they're young. Let's educate our illiterate people about the disadvantage of alcohol, smoking, and the rest, because it's those weakness that contribute into all this problem. And tuberculosis, it is a preventable disease once you take the medication and take care of yourself. Like we shouldn't be losing people of something that we can prevent. Maybe natural death is possible, yeah, but if you know this thing can help this person, let's educate our society. And finally, into radiology center or into radiologists, anyone is welcome to my page. Ask me any question. Ask me of even how you can do radiology. It's really a great cause, and I really wish a lot of South Sudanese could do it. Most of us only go for nursing, public health, and economy, but there are some courses that we don't know that without them our society is really nothing. Anesthesists, radiologists, these courses really we encourage a lot of people to join us or to be part of it, so that because me myself right now I can't educate the whole of South Sudan, but if we are to be like from every state at least 10 people, we can really help our society. So any opportunity you get, maybe you get a scholarship or anything, specialize in a course that is not common in South Sudan. For my people abroad, specialize in courses that are not in South Sudan, and that's the only advice I could tell you. And any question, you're welcome to ask me.
Yeah, thank you so much. There's no more questions because we are running out of the time and people are celebrating, by the way. And I have some questions right there, but I will not just tell you because maybe you'll answer them next time because I'm going to have you next time. So, Dr. Nyabol, we're really happy to have you here in our call podcast. It's been a great time, and we wish that God will bless you. And the new year has started already. We wish that in this year you are going to get your own certificate, and you are also going to come to South Sudan and help some of your people that are suffering from some of the diseases that you can manage to diagnose. So, Dr. Nyabol, thank you so much, and bye bye from now. And thank you for joining here today in our call podcast. Okay, bye bye from now.
Bye bye.
Thank you. Thank you so much, Nyabol, for these wonderful conversations. And I think uh, we shall have you next time. This is really a great discussions, and I think we shall meet next time. Guys, thank you so much. If you have any discussion that you want to do with the call podcast, I advise you also you can just text me, and then we will arrange the time. We will also arrange the topic, and then we will come and discuss it. This is a first year, and we also wish you the best. This is the 1st of January 2026, and we wish you the best all the time. So thank you so much, and may God bless you all the time. Bye bye from now.